This medication contains two hormones, an estrogen and a progestin. It is used by women to help reduce symptoms of menopause, such as hot flashes and vaginal dryness, caused by the body making less estrogen. The progestin in this medication also helps to reduce the risk of cancer of the uterus. It may also be used by women after menopause to prevent bone loss. If you are using this medication to treat symptoms only in and around the vagina, products applied directly inside the vagina should be considered before medications that are taken by mouth, absorbed through the skin, or injected. Before you start using Norethindron-Ethinyl estradiol tablet contraceptives, make sure to read the patient information leaflet from your pharmacist. Take this medication by mouth once daily, with or without food, as directed by your doctor. You can take it with food or right after a meal to prevent stomach upset. The dosage of this medication is based on your medical condition and how you respond to treatment. It's important to take this medication regularly to get the most benefit from it. Try to take it at the same time each day to help you remember, and follow your dosing schedule carefully. Do not increase your dose or take this medication more often or for a longer time than directed. If your condition does not improve or worsens, be sure to inform your doctor. Common side effects of Norethindron-Ethinyl estradiol tablet contraceptives may include stomach upset, nausea/vomiting, bloating, breast tenderness, headache, or weight changes. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people using this medication do not experience serious side effects. However, it's essential to inform your doctor immediately if you experience any serious side effects, such as nausea/vomiting that doesn't stop, mental/mood changes, breast lumps, unusual vaginal bleeding, increased vaginal irritation, severe stomach/abdominal pain, yellowing of the eyes/skin, swelling of the hands/ankles/feet, increased thirst/urination, or any symptoms of a serious allergic reaction. This medication may rarely cause serious problems from blood clots. Seek medical help right away if you experience symptoms such as chest/jaw/left arm pain, unusual sweating, sudden/severe headache, weakness on one side of the body, confusion, trouble speaking, sudden vision changes, pain/swelling/redness in legs, tingling/weakness/numbness in the arms/legs, trouble breathing, coughing up blood, or sudden dizziness/fainting. It's important to note that this is not a complete list of possible side effects. If you experience any other effects not mentioned, contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects, or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report side effects to Health Canada at 1-866-234-2345. It's important to talk to your doctor about the risks and benefits of using Norethindron-Ethinyl estradiol tablet contraceptives. These medications should not be used to prevent heart disease or dementia. In postmenopausal women, taking estrogen with a progestin can increase the risk of heart disease, stroke, blood clots, dementia, and certain types of cancer. The risk of serious side effects may depend on the dose and length of time the medication is used. It's best to use the lowest effective dose for the shortest amount of time. Make sure to regularly discuss the use of this medication with your doctor to see if it is still necessary. If you will be using this medication long-term, you should have regular complete physical exams as directed by your doctor. Before starting this medication, make sure to inform your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions. Discuss your medical history with your doctor, especially if you have a history of certain cancers, blood clots, heart disease, liver or kidney disease, high blood pressure, diabetes, or other health conditions. It's important to avoid smoking while using this medication, as it can increase the risk of certain health issues. If you are planning to have surgery or will be inactive for a long period, let your doctor know, as this can also increase the risk of blood clots. Additionally, this medication may cause dark spots on the skin, so it's important to limit sun exposure and use sunscreen. If you wear contact lenses, you may experience vision problems while taking this medication. It's important to discuss any vision issues with your eye doctor. Norethindron-Ethinyl estradiol should not be used during pregnancy, and it may also affect the quality and quantity of breast milk, so consult your doctor before breastfeeding while taking this medication. It's important to be aware of potential drug interactions with norethindron-ethinyl estradiol tablet contraceptives, as they could affect how your medications work or increase the risk of serious side effects. Be sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with norethindron-ethinyl estradiol tablet contraceptives include aromatase inhibitors, fezolinetant, fulvestrant, aspemifene, raloxifene, tamoxifen, toremifene, tranexamic acid, and certain combination products used to treat chronic hepatitis C. Additionally, this medication may interfere with certain lab tests, potentially causing false test results. Make sure that lab personnel and all your doctors are aware that you use this drug. If you suspect an overdose and the person is experiencing severe symptoms like passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can reach your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of an overdose may include severe nausea and vomiting, as well as unusual vaginal bleeding. If you notice any of these symptoms, seek medical help as soon as possible. Remember, do not share this medication with others. It's important to have regular checkups while taking this medication, including blood pressure checks, breast exams, pelvic exams, and pap smears. Follow your doctor's instructions for examining your breasts and report any lumps right away. Make sure to keep all medical and lab appointments and consult your doctor for more details. Preventing or controlling high blood pressure, high cholesterol, and diabetes can help reduce your chances of heart disease and stroke. Lifestyle changes like reducing stress, eating a low-fat/salt diet, losing weight if overweight, exercising regularly, and stopping smoking can make a big difference. Keeping your mind active with mental exercises like reading and solving crossword puzzles can help prevent dementia. Talk to your doctor about lifestyle changes that might benefit you. If you're experiencing hot flashes, making some lifestyle changes like stopping smoking, dressing lightly, avoiding spicy foods, caffeine, and alcohol, and reducing stress can help reduce them. To promote healthy bones, consider increasing weight-bearing exercise, stopping smoking, limiting alcohol, and eating well-balanced meals with adequate calcium and vitamin D. You may also need to take calcium and vitamin D supplements, so consult your doctor for specific advice. And remember, it's important to make these lifestyle changes to support your overall health. If you forget to take a dose, just take it as soon as you remember. If it's almost time for your next dose, then just skip the missed one. Make sure to take your next dose at the usual time. Don't take double the dose to make up for the missed one. Make sure to store your norethindron-ethinyl estradiol tablet contraceptives at room temperature, away from light and moisture. It's important to keep them out of the bathroom and away from children and pets. When it comes to getting rid of any leftover medication, don't flush it down the toilet or pour it into a drain unless specifically told to do so. Instead, talk to your pharmacist or local waste disposal company about the proper way to discard the product when it's expired or no longer needed. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.